At the heart of everything Sanford Health does, we're always focused on delivering world-class care, to meeting every patient where they're at to ensure that they have access to high-quality care. But in addition to that, we also have as a distinct responsibility and a privilege to serve our communities.
All of the things that we do to engage our communities, listen to them, and then program to help support them. That's how Fairview continues to engage to be able to not only improve patient health, improve population health, but improve community health. In fact, the building we're sitting in is the hub for community health and wellness. Our concept here was, yes, bring clinical services together, but combine that with other key services. It's with community partners who are experts in their own right with one common cause, which is improve the health of individuals and the communities in which they live.
We want this to not feel like a hospital when you walk in. We want you to feel like you're in a place where different cultures and backgrounds are reflected and valued.
I'm excited, I'm encouraged when I have the opportunity to spend time here at the hub. There is a model out there where you can bring together all of those community partners.
This is our hub, but everything happens in communities. So we bring everything that we need to be providing whatever service it is that we're providing that day.
Fairview is a great resource for support us to provide health professionals in order to offer services for the Mexican and Latino community.
Thank you. Nice job.
Thank you.
My hat's off to the great work that you all have done here, and I'm excited about our ability to do more of that together.
Hello. How are we doing? Good. How are you doing?
Oftentimes, one of the most significant barriers between individuals living a healthy life and where they may be at today is access to good, healthy food.
I got it.
For us, we see as a part of our opportunity and responsibility is not only delivering great clinical care, but it's also making sure that they have access to that life-saving substance that they need, food.
We're at the castle, we're at the Children's Specialty Clinic, and we're very excited that we now have a food pantry here for our patients.
We distribute about 1,700, 1,800 pounds per week. We get many patients who travel significant distances and really represent the communities that surround us, both in South Dakota, Minnesota, Iowa, Nebraska, and also up in North Dakota. The challenges of the social determinants of health, they're not going away. But a healthcare institution steps up to that challenge, and we're proud to be part of the solution.
It's one of those many ties that bind Sanford Health and Fairview Health Services together.
Fairview's digging into a food as medicine strategy, so really thinking about what does the next 10 years look like and how can we get to our ultimate goal of eliminating food insecurity for our patient population and community members. 28, 29!
You're gonna have 2 breads today.
We get this food from the Wellness Hub with Fairview, so we mobilize there every single day.
It's a blessing. Is that hummus? If I ain't have it, wow, we get that.
And on Tuesdays from 3 to 5 p.m., we bring that food on site here, and our staff helps give it out to the community.
I found this place, I was like, oh, okay, that's good for me. Like a lot of, some food, something to eat.
It's awesome to talk to Bill about his dad and the involvement in hunger relief.
I had the privilege of having a father who led the state of South Dakota's only hunger relief organization.
How can some of our learnings around food as medicine and food programming be translated over there and vice versa?
Y'all have a wonderful day.
If we're really going to serve our patients, we're going to really serve our people and our communities, the only way we're going to do that is through trust.
And trust is about commitment to the relationship, right? And that means you have to be there.
One of the great examples is Bemidji and the Well-Briety program that we have been able to establish in partnership with the tribes and the reservations.
Come on in. Well-Briety is an international standard of care for Native American cultural addiction recovery.
We're surrounded here by 3 huge Native reservations. So there's upwards of 25,000 Native Americans that live in this area.
Sanford was super amazing at saying, how do we do this? How do we become culturally responsive? And how can we help you do that?
And I want you to think about spiritual connection.
We have to make community here. We have to create a safe place for people to come here and experience the cultural connections that they're familiar with. You are a sacred being. It really speaks volumes to the communities around here that says, we really value how you go about your healing, and we want to create that space for that to happen for you.
I want to be a bigger part of the community.
I think about those little rural communities. When we come together, between Sanford and Fairview, being able to reach out to them is going to make a phenomenal difference between our indigenous populations.
These things aren't going away, and I'm really excited about the commitment of both organizations.
We have 6 culture brokers serving 5 cultural communities: African American, Hmong, Karen,
American Indian, and 2, serving the Hispanic Latino community. And it can be as simple as helping someone fill out a form, to helping someone help find housing, to helping folks navigate healthcare, or even government system.
Not only is Fairview connecting with the community, it's giving the community hope.
Que existe la ayuda.
That the help does exist.
Que hay ayuda aquí, que no estamos solos.
That help is here, that we're not alone.
Que de verdad hay gente que quiere ayudarnos.
And then there really is people out there that really want to help us.
It's incumbent upon us to build that trust, to go meet people where they're at.
The community's needs aren't constant, right? And so you want to continue to be able to adapt to those community needs, have that ability to listen, to engage.
What we do will never change. We care for people, right? We provide cures, we provide comfort. How we do it will change, it has to change, and needs to continue to change.
That's right. I am incredibly excited about our ability to strengthen communities together in ways that we simply could not do as separate organizations.
Strengthening communities together, Sanford Health and Fairview Health Services will build stronger, healthier communities.